There is a shortage of nursing and allied health practitioners in rural and regional areas, but we know that these services are crucial to meet local health needs in local communities. Rural and regional communities face difficulties in accessing appropriate healthcare and in recruiting allied health and nursing professionals into the regions. And that's why students are the future of rural healthcare.
The Going Rural Health program has been designed to help students going on a rural placement, and we know these needs are because the cost of living expenses are so high. So we're trying to address those by offering support services to students like subsidised accommodation throughout regional and rural Victoria. It really allows the student to focus on their rural placement and have the most positive experience they can.
So this is my first rural placement. I would say some of the benefits I've experienced so far is the autonomy in learning. I guess in a metro hospital you are constantly under that supervision, which one can be quite daunting and I guess affect your performance sometimes. So it's really nice to have that independence and see how you might function as a clinician. Working with the patients has been really lovely. It's a really lovely community out here and everyone knows everyone. It's just a really lovely environment and it's really great because you get to spend so much time with the patients due to the slower pace. You get to see them make these advances and improve and you get to see really tangible outcomes, which I guess you don't really get to see in the fast-paced hospital where you go from one patient to the next and there's a lot of turnover. So it's really nice to see your, I guess, like studying and hard work making a difference.
I chose to do a rural placement because I feel like I wanted to challenge myself, try something new and feel like I can give back to a community that may not have access to care. When I was in Horsham, over the weekend I went to the Grampians both days, which was really fun. I really got to see a part of Victoria that I've never been to. I might not have gone to if I hadn't had rural placement there.
All our students go rurally because rural placement is where they learn the most, and when we ask them at the end of the year, it's actually the most valued placement that they've done in the whole year. There's not as much healthcare usually rurally, so the students have to step up and do more, and that just really places them in a good spot to be ready to graduate. So we highly value all our students going rurally.
I love students. Watching them grow is everything to me. So often the allied health students come in having no experience in rural health at all, having no idea what they're getting into. And by the end of it, the smiles on their faces and the experiences that they've been able to have is just so rewarding.